Welcome. Through waste contamination. Health hazards. What are wastes? Health hazards. Many of the studies investigating health outcomes other than birth defects and reproductive disorders and cancers have been community health surveys and have relied on the self-reporting of symptoms through interviews or questionnaires. These are comprehensively reviewed by Rigid 10. The health problems investigated include respiratory symptoms, irritation of the skin, nose and eyes, gastrointestinal problems, fatigue, headaches, psychological problems and allergies. It has been suggested that evaluation of a relationship between these symptoms is complicated by confounding by stress, public perception of risk, odors and nuisance related to the site, and recall bias. For example, a survey 31 found that residents who indicated they were worried about pollution reported more symptoms than those who were not worried, both in the exposed and control areas. Studies focusing on a single waste incinerator suggested some relationship between distance from the site and mortality or incidence from some cancers, for example laryngeal and lung cancers, childhood cancers and leukemias and soft tissue sarcoma and non-Hodgkin's lymphoma. A study of residents near MSW incinerators found statistically increasing risk with increasing proximity for all cancers and for colorectal, lung, liver and stomach cancers, although there was evidence of residual confounding for all cancers, stomach and lung. Because of the substantial level of misdiagnosis which can occur among registrations and death certificates for liver cancer, the authors carried out a histological review of the cases and reanalysis for this disease. Reduced estimates of excess incidence of primary liver cancer were reported. You are exposed to numerous chemicals every day, in the air, food and water. There are also chemicals in products used at work, at home and at play. Exposure to most of these chemicals is not harmful. But in some cases exposure can affect your health if risks aren't properly managed. The health risks of chemicals depend on several factors, such as the type of chemical, the amount you're exposed to, when and how long you are exposed, how you're exposed through food, water, air, products and so on, your age and general state of health. Depending on the chemical, there can also be longer-term health effects. Organ damage, weakening of the immune system, reproductive problems and birth defects, effects on the mental, cognitive or physical development of children, cancer. The end. Submitted by Mohammed Irfan AC.